Hello everyone, welcome back to my channel. Today we are going to discuss an extremely important topic for your exam, rather practical exam, that is CNS examination. So why it is important, students? Because you may be getting a long case both in medicine and pediatrics from your CNS, okay? So let's begin with. So there are basically 10 points of CNS examination, okay? I will be detailing them separately. So the first point is higher functions, okay? So, in higher functions, what are the points you need to know? Let's make a mnemonic, that is COMIS. C stands for level of consciousness. O stands for orientation. As you all know, orientation to time, place, person. M for memory. I for intelligence. And S for speech, right? So this makes your higher functions, okay? Next, moving on to the next point, that is head and spine. Okay, so in head and spine, you are going to see the size and shape of the head. Okay, in pediatrics, definitely the fontanelles, if open, the sutures, okay, and so on. And in spine, you are going to look for whether there is a rather palpate for any spina bifida occulta, okay, or whether there is any evident tuft of hair, okay, or any evident meningocele, meningomyelocele, okay. If these are the things present, you need to mention. And a very important extra point is signs of meningeal irritation. What are they? Yes, neck rigidity, Karnick sign, and Brudzinski. Okay, Brudzinski's, there are two, Brudzinski's neck and Brudzinski's leg sign. Clear? So this is your all about your head and spine. Next is your third point, that is the cranial nerves. Okay. So here basically how many cranial nerves are there, students? Yes, there are 12 pairs of cranial nerves, and you need to mention each of the cranial nerves separately, 1, 2, 3, and so on up to 12. Okay, if you want, I can upload a separate video for cranial nerve examination. Okay. Next is your, yes, motor functions. So again, there are many points in motor functions. Let's make a mnemonic, that is prag tig. Okay. So P stands for power. R for reflexes. Here you have to mention the deep tendon reflexes and the superficial reflexes. In power, you need to grade the power, okay, from 0 to 5. Okay. Next is your A. A stands for whether there is any atrophy or hypertrophy of muscles present or not. Okay. Next is C. You need to mention the coordination. T stands for tone, of course. I stands for any involuntary movements present or not. So what are the involuntary movements, students? Yes, tremor, athetosis, all these. G for gait. So this completes your motor functions. Okay, so just remember the mnemonics so that you don't miss any points. Okay, next is your sensory functions. So among sensory functions, you need to divide it into three subparts. What are they? First is the crude sensations, next is the fine sensations, and the last is the cortical sensations. Okay, so basically in pediatrics, we generally do the crude sensations only, like, yes, pain, temperature, as you know, all these, because pediatric children generally, they are not being able to elicit the fine. Like if you ask them, if you just touch a wisp of cotton and ask whether they can feel it or not, they won't be able to do so. And what are the cortical sensations? As you all know, 2 point discrimination, stereognosis, and so on. Okay, so next, moving on to the sixth part, that is, so as I told you, this will be reflexes, and there are basically two types of reflexes. One is the superficial reflexes, and the other one is DTR, that is the deep tendon reflexes. So students, if you want, I can upload a separate video on reflexes. Okay, so just let me know in the comment box. Okay, so next is your cerebellar signs. So you may be getting a short note in theory as well. What are the cerebellar signs? So all of you are knowing basically, nystagmus, the pendular, knee jerk, okay, hypotonia, dysdiadochokinesia, and so on. Okay, so next point is your autonomic function. So here also you will be checking for the bladder bowel, okay, functions, and then you'll be checking for any postural hypotension. Okay, next, if there is any excessive sweating, you should mention. Okay, the ninth point is your trophic changes. Okay, here particularly, in pediatrics, if you are getting CP, that is cerebral palsy child, you may be finding trophic ulcers over bony prominence. Okay, so this you have to mention. And moving on to the last point of CNS examination is the gait. What type of gait the child is having, if it's a hemiplegic gait or a waddling gait, that you have to mention. So that's all about CNS examination, students. Basically, this 10 points you should remember. And I guess this video was useful. Okay, so we'll be again meeting soon with a lot more important topics. Thank you.